Hi friends, welcome to my YouTube channel Future Midwife. I hope you could see my last section. In the last section, I have taken what you mean by labor, causes of onset of labor, different factors affecting labor, and physiological effect of labor. So those who have not seen my last class, please watch it. Then only you will get a continuation of topics. So today I am going to take different stages of labor. As you know, there are 4 stages of labor. So we will see one by one. The stages of labor can be divided into 4. First one is first stage of labor. So the first stage of labor is otherwise called cervical dilatation stage. So here the cervical dilatation stage start from the onset of labor. That means the onset of true labor till the full dilatation of the cervix. The second stage is otherwise called baby delivery stage. That means after the full dilatation of the cervix till the delivery of the baby, we called it as second stage of labor. The third stage of labor is otherwise called placental delivery stage. That means after the delivery of the baby till the delivery of placenta, we called it as third stage of labor. The fourth stage is otherwise called postpartum. This starts after the delivery of placenta till 4 to 6 weeks. Here I will explain the first stage little bit elaborately. So as I said you, this is the onset of labor to complete the dilatation of cervix. Here a typical pattern for the latent phase contraction begins by lasting about 40 seconds and coming every 10 minutes. By the time the contraction will last for more than a minute and come every 30 seconds. The first stage is again divided into 2 phases. First we called it as latent phase. Contraction becomes frequent, very strong and painful. Cervix dilates about 4 cm. The second phase is called active phase. Dilatation of the cervix from 6 to 10 cm. Contraction become regular, longer, more severe and more frequent in most cases. The active phases is shorter than the latent phase. When it comes to the second stage of labor, it starts with the full dilatation of the cervix till the delivery of the baby. The second stage is often called as pushing stage because during this stage mother is getting good uterine contraction, and along with the good uterine contraction mother push the baby from the uterus. The baby head is seen from the vaginal outlet. It is called as crowning. This second stage is shorter than the first stage. Usually in the primary mother it takes 1 to 3 hours, whereas in case of multipara it's finished within 30 minutes. In the third stage, it is the delivery of the placenta which occurs after the birth of the baby and the umbilical cord is clamped. Once the baby has been delivered, it may be left for 2 or 3 minutes before cut the umbilical cord. The mother may experience some bleeding. This stage usually lasts just a few minutes up to half an hour. The fourth stage starts from the delivery of the placenta till 4 to 6 weeks. So this is the crucial period for both mother and child. Child need to adjust to the external environment. There should be a keen observation for the hypoxia and hypothermia. When it comes to the mother, we need to watch for uterine contraction, vaginal bleeding, blood pressure, heart rate and temperature variation. All those things has to be monitored. Fourth stage is an excellent stage to initiate the breastfeeding. Through breastfeeding, baby and mother develop a bonding relationship. So till now I have explained the 4 stages of labor. Next we'll move on to the pre-preparation to labor. First we will see the preparation of mother. In that, first point is woman should be kept in the bed. Second one, positioning of woman during labor may be lateral or partial sitting. Dorsal position with 15-degree left lateral tilt is commonly favorable to avoid aortocaval compression and facilitate pushing. Toileting of external genitalia should be done by using antiseptic solution. One sterile sheet should be placed beneath the buttocks and above the abdomen of the mother. Never leave the woman alone. Ensure the bladder is empty. Sponge the face with soaked towel. Provide water and juice. Keep constant monitoring of fetal, mother and labor conditions. When it comes to the fetal condition, check fetal heart sound in every 5 to 15 minutes till delivery or apply continuous monitoring if possible. Record its rate and rhythm per minute. Observe for membrane rupture and its color and detect accidental cord prolapse. Record and report any abnormalities. When it comes to the maternal condition, check the pulse every 15 minutes and BP every hourly and record it. Watch for maternal distress and inform any abnormalities. Observe and record the progress of labor by abdominal and vaginal examination. Monitor the labor condition, that means uterine contraction, its strength and interval of contraction on abdominal examination and descent of presenting part and rotation of the fetal head by vaginal examination. Next we'll see the preparation of midwife or nurse. Collect all necessary information from the woman and chart which are necessary for delivery. Timing of self-preparation depends on the rate of labor advancement and parity of the mother. In multiparous woman who is progressing rapidly, so scrub towards the end of the first stage of labor. In primigravida, when full dilatation of the cervix occurs or crowning of the head occurs during contraction. Early scrub tend to become contaminated and a risk of infection. Prepare the oxytocin injection 10 unit for third stage of management. Put on clean and dry plastic apron. Nails should be shortened. Hair should be tidy and remove all ornaments. Wash the hands with soap and running water. After washing or scrubbing the hands, dry on air or dry with sterile towel by keeping the palm upward in Namaste position. Prepare delivery set and open the delivery set. Put on sterile gloves. Keep the all necessary equipments and article nearby her. Ask the circulatory nurse or circulating health workers to monitor fetal heart sound, contraction and maternal vitals regularly. Next we'll see about preparation of delivery room. Before second stage of labor reached, the delivery room should be prepared for the birth of the baby. Room and floor should be cleaned with soap, water and antiseptic solution. Maintain proper and adequate lighting and adequate ventilation. Maintain room temperature up to 25 degrees centigrade. Prepare perineal light. Maintain safe environment, that means dry and clean floor, clean bed and furniture. Maintain comfortable by adjusting bed with pillows and blanket. Macintosh to protect the bed and floor. Floor bucket to collect soiled things. Clean sheet to cover the mattress. Keep ready episiotomy set. Keep ready IV stand including IV set and IV fluids. Usually we keep Ringal lateral. Prepare oxygen cylinder, nasal tube, emergency medicine and suction machine. Keep ready neonatal resuscitation set, warm baby cloth, weighing scale, room heater, etc. Prepare for patient trolley for emergency transfer. Prepare screen, bedpan and vital sign set. Keep ready sterile parts, gauze pieces, cotton balls, drugs, antiseptic solution and local anesthetic drugs for perineal infiltration. This section never ends without explaining the essential equipments and medication used for labor. This will be displayed on the screen. Please have a look. So in the next class, I will continue this section with the mechanism of labor. Till that, take care. Bye bye.